All right, so Rick's Smiley Morning Show, 14 before the top of the hour. Yeah, we got the one and only Dr. M.J. Collier on with us this morning. Dr. Collier, good morning.
Good morning, Rickey, Smiley, and all the morning show listeners. It's time for your coronavirus update, and we have some great information for you. We're going to tackle a couple of topics here, Rickey. One, the number of cases now is 2.02 million. The number of recovered individuals are 602,000. The number of deaths are 114,000. Remember, the 100,000 mark was just celebrated a week ago, and now we are up to 114,000. That was basically another 1,000 deaths in the last 24 hours. So we're seeing an increase in the infection rates in 21 states, although overall the rates are going down, but in 21 states they are going up. And some of the pushback that we're getting is they're saying, well, we're doing increased testing, so that's why the numbers are going up. But we're also getting an increase in hospitalizations. That means that these are true increases and not just increases due to our increased testing capability, but that the virus is still there and still infecting a lot of people. So there was also some discussion yesterday about some of the things that had been said by the World Health Organization. But let's be clear, 1/3 of the infections are asymptomatic, people that get infected. Up to 1/3 don't even know they have it, and so that means they're spreading it. And up to 40% of transmission happens before a person that does have it becomes symptomatic. So you look at those numbers, so that means over half of the people that have it and are carrying it are sharing it with other people, and they're not doing it intentionally. They have no idea that they have it because they're not having any symptoms. I've spoken with you and told you that I'm testing individuals in my office for the antibodies, and that confirms that they have had infection. And I have had probably at least 1/3 of those individuals who had no symptoms, denied any exposure that they were aware of, yet they tested positive for the antibodies, which showed that they did have exposure and the disease.
Let me ask you something real quick. Is that a different kind of coronavirus, like if somebody had it, or it's the same virus that's killing people?
No, it's the same virus that's killing people. But remember, you have 80% of people will get the infection and get over it. So it's the same one. And then you have 10% of people that have a bad case and may even have to be hospitalized. And then 5 to 10% of people are going to die from it. So it's the same virus. It's just that people will respond differently depending upon the quality and capability of their immune function. And the people that have strong immune systems, they're going to fight it off. They may not even be aware that they had it. And that's where we want everybody to be. We want everybody's immune system to be boosted, and that's where they are.
So asymptomatic is like having herpes, but you ain't got no blisters around your lips.
That's a great correlation. Those symptoms, but you do have it. And they always say, I've never had it on my lips. They never talk about that, having blisters down below the belt line. They say, oh, no, I've never had any fever blisters on my lips. But, it happens. And there are cases of people that have done that as well. So keeping it medically correct, that's true. Now, look, the National Guards have been deployed. There were about 5,000 in Washington, D.C. from 11 states. And they have had individuals from the National Guard that have tested positive for the coronavirus. Now, supposedly, everybody that was deployed was tested before they were deployed, and they were negative before they were allowed to go and be deployed. So that means that they did contact the virus while they were on active duty and dealing with people that were protesting. So we now have multiple cases. They don't know what the number is because they won't release that. But those individuals now, they're going to be extended for at least another 14 days to get through a quarantine period. But some of these people have been sent home already to 11 different states. And so they're supposed to self-report if they develop symptoms. But I just told you 1/3 of people have no symptoms. So those individuals can take the virus back from Washington, D.C. to wherever their home states are. And there are 11 states that they're doing it and spread the virus around. So we're really going to see. So what has been predicted has happened. People that have been protesting have now, we have documented infections in people that were National Guard members. Now, you saw people, and some of the National Guard did have on protective equipment, but a lot of them did not have on anything, including masks. So they were increased susceptibility. That's where we are with that, Rickey.
Well, if you want to talk to Dr. M.J. Collier, you can call right now, 866. If you have any questions, call with your questions, 866-9RICKEY. Dr. Collier's topic for today is just because they don't come out don't mean you don't have roaches. More Rickey Smiley Morning Show coming up. All right, Rickey Smiley Morning Show. Hey, we got the one and only Dr. M.J. Collier on with us. Dr. Collier, thank you for joining us this morning. We're taking your phone call. Let's go right to the phone. We're talking about COVID-19. Rickey Smiley Morning Show. Good morning. You're on with Dr. M.J. Collier.
Things, sucking that hot air, breathing the hot air, put the hot air to your nose and breathe in the hot air, and does that kill the virus if you have it?
No, I've seen that mythology being perpetuated on social media as well as other sources on the internet. No, that is not true. Otherwise, places where it is warm, like Brazil, would not have the number of cases that they have. So putting the blow dryer in your nose is not going to help kill the virus. So the best thing to do is protect yourself. Don't touch your nose, mouth, or face. Cover your eyes. Wear a mask. Wash your hands. And social distancing. That's what you need to do, and boost your immune system.
All right, you're on with Dr. M.J. Collier. Good morning.
My question is, I've seen on articles about COVID virus being found in semen, so I'm just wondering if that's true and if they've decided if this is a sexually transmitted disease.
That is absolutely correct. We spoke about that months ago. But, yes, it has been found in semen, and it's probably in vaginal fluids as well. It probably can be detected in any body fluid that you secrete. It has been found in tears. So everything from tears to semen. It's just that the amount that you have, that question is that enough to give you an infection? But it is there, so the possibility of infection does exist, which means that it could be transmitted sexually. So the recommendation was for individuals that were infected, particularly men, to practice safe sex until they were through the quarantine period.
And wrap her up in some plastic. All right, you're on with Dr. M.J. Collier. Good morning.
I want to know, like, if you don't have the symptoms of the coronavirus and you are indeed too spreading, how do you know when you are over the coronavirus, if you did have it?
Well, if you don't know that you have it, you won't know that you're over it. You'll go through the entire thing, and probably after about 2 weeks of having it, your body's immune system is obviously doing a good job of fighting it. So you should, at that point, test positive for the antibodies and have some level of immunity. So that would be where you would be with that. So you won't know that you had it, you won't know that you've gone through it, and you won't know whether you passed it to anyone. That is the problem that we're having now, and that's why it's being spread so much in the community.
All right, you're on with Dr. M.J. Collier. Good morning.
Thank you so much. I was tested on May the 5th, and my IgG levels were negative. And so now that I'm trying to get ready to go back to work, I'm wondering, do I need to get another test? And I'm just wondering, is there a time period to wait and get another test, or how often should you get the testing done for the antibodies and the COVID-19 testing?
Okay, very good question. One, the antigen test, the nasal swab that you're so familiar with, that you have seen on television and on social media, that test is for the antigen. When you're testing for the antigen, that determines whether you actually have infection at that time. After you have gone through infection, hopefully your body has made antibodies. That is the IgG, that's immune globulin G, which is the great antibody, gives you long-term protection. There's a shorter-acting antibody, IgM, that shows where you are along the spectrum of infection. So you'll get IgM immediately, and that builds up, and then it disappears, and then your body should make IgG. So if you tested negative for the antibody, it means you may not have ever been exposed and may not have the disease, and that makes you more susceptible to exposure. I would test again as often as every 14 days to see if you have the IgG antibody. That means that you had the infection, your body has cleared the infection, and now you should have some level of immunity.
All right, if everybody if you take these vitamins every single day, if you do catch COVID-19, you probably would definitely your body would flush it out and build those. Your immune system is just so high, your body would fight it off. And if you want to find out which vitamins you need to be taking, Dr. Collier, give them your website.
Lipodrops, LIPODROPS.com, lipodrops.com. We're getting great success with boosting the immune system using omega-3 fish oil, probiotics, vitamin D, and we have another product now called Lipoimmune that has zinc, vitamin C, and elderberry extract. Elderberry extract. Okay.
Hey, Dr. Collier, I appreciate you, man. Member of Alpha Phi Alpha Fraternity Incorporated, founded in 1906. Graduate of Morehouse College, but go on, do your disclaimer.
Okay, these are the opinions of Dr. M.J. Collier and only Dr. M.J. Collier, and not the opinions of the Rickey, Smiley Morning Show or its radio affiliates. So always check with your own provider to get your own personal healthcare information. This is not meant to diagnose or treat any disease.
There it is. Hey, thank you, Dr. Collier. Gary got the tea and the Collier today. Coming up next, Rickey Smiley Morning Show.